This year, we commemorate World Tuberculosis Day under the theme "The Clock is Ticking." While South Africa and the rest of the world continue to battle with the COVID-19 pandemic, TB remains one of the world's deadliest infectious killers. Each day, nearly 4,000 people lose their lives to TB and close to 28,000 fall ill with this preventable and curable disease. At the South African Medical Research Council's TB platform, we study and develop the prevention and treatment of TB and try to find solutions to problems experienced by TB patients. We focus on the policies and treatment guidelines used by nurses and doctors to identify the gaps and provide evidence on how to improve TB services. The director of the TB platform, Professor Martie van der Walt, was the co-principal investigator of the first National Tuberculosis Prevalence Survey of South Africa. The survey showed for the first time a much clearer picture of TB in our country, a huge advance in TB control. It also showed that communities have little understanding of the signs and symptoms of TB and that our current methods miss about 20% of people with TB. Through outreach programs, we aim to improve their understanding of TB and design specific programs in clinics to focus on the health needs of younger people and men, which can bring about significant impact on reducing the burden of TB. The annual World TB Day is an important day in the TB calendar of South Africa and the rest of the world. It is a time for heightened public awareness about the devastating health and socio-economic consequences of TB. We have seen how the world has united in the fight against COVID-19, with campaigns providing us with information and simple ways on how to protect ourselves and slow its spread. Governments globally have recognized the need to build on the systems that were put in place for COVID-19 to fight other diseases like TB and HIV. The day is also a time to mobilize leaders, politicians, funders and policymakers to join and maximize the fight against TB. The clock is ticking.